Welcome to the Six Hats podcast, where I, Dr. Shami, a lifestyle and nutritional medicine family doctor, will talk about how women strive to find balance each day by juggling their six roles, being a woman, mother, daughter, partner, business owner, and professional. Welcome everyone back to the Six Hats podcast, and today we're all talking about low carb. And I'm so excited to have Dr. Deepa Mahananda join us. Now, she is a general practitioner in Sydney. She set up Sydney Low Carb Specialists. She is passionate about low carb nutrition for both optimal health and chronic disease management, and especially women's health. She is also leading an educational network for low carb practicing GPs in Sydney. She is certified ketogenic nutrition specialist, credentialed by the American Nutrition Association, and she's also a member of Low Carb Down Under. And what we're going to sort of go into today, we're going to talk about also the Society of Metabolic Health Practitioners that she's involved in as well. So she has a full life. Welcome, Deepa.
Thanks, Shami. Thank you for having me on. I really appreciate it.
So from your bio, you absolutely love low carb and the whole keto world, but I'd love to know, what was your journey into it? Was there something like a personal story that you can share?
Of course. I think like a lot of other doctors who found their way to this space, we often found our way there through a personal experience that changed the way we thought about our health and how to optimize our health, and also importantly, what to do when you're actually having a medical problem and where to look for that help. So for me, when I was in medical school, I had always wanted to do general practice. And the reason for that was I thought it was the profession where I would be involved in the prevention of chronic disease. And fast forward to graduation, and I became a general practitioner after years of training. I discovered that when I was practically in that role, there wasn't actually that much focus on prevention. Rather, it was more about reactive medicine and giving people prescriptions as a potential, like as a often first line default reaction in the consultation. And I didn't really feel that sat well with me, because as a doctor, I had that curiosity of, was it that is actually causing this underlying disease? Why is it that I provide a prescription and perhaps some general lifestyle advice, which is usually centered around eat less, move more, and that these patients would represent and actually either be the same or sicker? And that was really concerning for me. So I did actually have the lovely experience of seeing some patients who had taken the situation into their own hands, and they were starting to report some improvements with using low carbohydrate dietary approaches with their own health. And I thought that was really intriguing. And around the same time, I also discovered some of the work and articles shared by Dr. Gary Fetke, who's a practitioner in Tasmania, an orthopedic surgeon who had quite an interest in how to reverse and remit type 2 diabetes in his patients he was having to do amputations on. So that was really opened the doorway into understanding more and learning a lot through attending some conferences run by Low Carb Down Under. And from my own sort of personal journey that was parallel in this professional journey was that I was diagnosed shortly after I was at the end of my medical school degree with stage 4 endometriosis, which was quite a bit of a shock. I didn't really have a lot of problems other than painful periods. That was specifically the issue that I'd always just put down to, well, that's just the way it is. And of course, I now know that's not how it's meant to be, and that periods are really a vital sign for a woman. And with my journey through that, I opted for traditional management because that's all I sort of knew at the time. And I followed the guidelines and I followed my gynecologist's recommendations. I had quite an extensive surgery to remove it. And thereafter, that's when I started to think about, is this really a chronic condition that I can never really do much about and I have to kind of live with this ongoing? Or is there something I can do that's one of my controllables that might actually create a anti-inflammatory effect within my body and also tame the immune system in a way that means I don't produce as much of the tissue that was affecting my pelvis? So that's when I started to apply initially a paleo dietary approach. And then after I discovered a ketogenic diet, I extended that further, and I've reaped the benefits immensely from doing this. And I can say today that I'm completely in remission from this problem with endometriosis. And unfortunately for a lot of women, they don't achieve this because they don't have that information and the knowledge provided to them, that is a possibility.
That is so inspiring, Deepa, because we're going to get into it. But often when we think low carb diet, people are always thinking weight, just getting the weight down, body image, and that's their motivator. Less often do we link low carb ketogenic with inflammation. And that is key. And I love to get that message across. And you gave an amazing example, an amazing result as well. It is inflammation when we think about sugar and how it creates inflammation. And a lot of our chronic conditions does create inflammation, which kind of goes on to my next question. The first one I'd love to say is, how do we differentiate between low carb and a keto diet?
So I always see low carb, or at least that terminology, as an umbrella term. And in, say, a standard Australian diet, most people are consuming about 300 grams on average of carbohydrates, mostly through whole grains, and vegetables and fruits are also included within the whole carbohydrate intake. So that is, I suppose, the upper end of the carbohydrate spectrum, where people are having 300 to 400 grams of carbohydrate per day. And then when we start to look at lower ends of that, so liberal low carb would be around about 100 to 150 grams of carbohydrate per day. Then we'd have moderate low carb, which is between 50 to 100 grams of carbohydrate per day. And then when you're getting underneath 50 grams of carbohydrate per day, some people who are quite metabolically well would be entering a state of what we call nutritional ketosis. And that's where they're producing their own ketones, either from the fat that they consume within their dietary approach or from the fat that is stored on themselves as well. And that's where we start to describe the low carb diet as a ketogenic dietary pattern. Now, that doesn't always occur at 50 grams of carbohydrate per day. As I mentioned, you'd have to be quite metabolically well to be producing ketones at that amount, and or a very active individual, more so than just your casual gym goer. And usually, though, for people who may have a chronic medical condition like high blood pressure, type 2 diabetes, heart disease, those conditions, we would usually be aiming for around 20 to 30 grams of carbohydrate per day, because these are really conditions seen in metabolic syndrome. And that's kind of where we would actually have the greatest effect, both on being able to burn fat or become a fat burner, which is nutritional ketosis, but also for all those anti-inflammatory effects, because as a completely in isolation effect, ketones themselves are actually and have an anti-inflammatory effect, even just apart from the fact that they're useful as an energy resource within the body. So that's kind of where they give you what they call, I suppose, a hitting many birds with one stone in one way is how I could describe that. So what you notice is a cascade of events that occur when someone starts to get down that lower end of the spectrum with carbohydrate intake.
That was beautifully explained. And I think it's really nice to give an idea. What does 50 grams of carb look like? Are we talking like 2 to 3 slices of bread, half a cup of cooked rice? Is that something that you...
Yeah, so we always use the example of a slice of toast. That helps most people understand. So 20 grams of carbohydrate are usually what is present in one standard white or whole meal slice of toast. It doesn't really matter. A lot of people think whole meal's better than the other kind, but at the end of the day, the body can only see this as an amount of carbohydrate that it needs to break down into its components, which are strings of glucose, to be able to use it as energy. So 20 grams of carbohydrates roughly is equivalent to about 4 to 5 teaspoons of sugar, which gets released to our bloodstream. And in the bloodstream, we can really only hold about 1 to 1.5 teaspoons of sugar at any one time. So if you kind of took the analogy of, when you drink alcohol and you can end up over the limit if you overdo it. So the same principle applies with every meal that you have. If we are exceeding that amount of the amount of blood sugar we can safely hold within our bloodstream, there will be for a period of time until our body can either take care of it with its inbuilt mechanisms, and that's where we get into the role of the insulin hormone. But that is really reliant upon the body dealing with that within a 2-hour period of eating, and then again bringing back tight blood sugar control. So you might end up releasing this 4 to 5 teaspoons of sugar, your body reacts, and then is meant to bring that back into control within 2 hours. However, for a lot of people, when they're eating in this pattern with foods they think are healthy for them, for the most part. People actually quite obviously know what are some of the more unhealthy foods in our food supply, being the processed packaged foods or our takeaway foods. They're probably something many people wouldn't argue about being unhealthy for us. But when you just look at things like whole grains and lots of fruit intake and a lot of below ground starchy vegetables, we can actually really add up the amount of carbohydrates that we are needing to deal with on a daily basis. And for anyone who does have, a weight issue, or there is another problem that represents metabolic syndrome, that's when they do need to actually understand that even the intake of those types of foods can actually cause a problem for them. So hopefully that kind of explains that, like even just a piece of toast or 3 Weet Bix can actually push you really over the limit, and some people can't deal with that amount of carbohydrate.
Makes so much sense, which kind of leads me on to my next question about chronic diseases. So we know absolutely, for weight loss, diabetes, sugar control. But, you mentioned endometriosis. What other chronic diseases can going into a keto state really help?
Yeah, I mean, it can help head to toe. And where, just to give some examples, are in the sense of particularly mental health, which is something that a lot of people don't necessarily associate with the way they eat. And we can actually provide a source of energy to our brain cells that can stabilize their activity, that can improve the connection between brain cells and the behavior of neurotransmitters within our brains, as well as there is also the well-established gut-brain connection as well, because we actually produce a lot of the neurotransmitters within our gut and some of those important helpful hormones as well that actually are part of the interplay with our brain and the way that functions. So when we are eating in a way that's not causing major roller coasters with our blood sugar, we can often see that there is less anxiety, because when people have high blood sugars, they can often feel on edge, irritable, and find that it is difficult to control ruminating thoughts and find it very difficult to fall asleep. So these are actually some components that at a foundational level can really help someone who's been struggling, even long term, with depression and anxiety, which often come together and is a bit of a chicken and an egg cycle to break. Then sort of looking further to the other parts of the body, there are the joints that can benefit. So many people overuse or having an excessive or suboptimal amount of fat tissue can actually cause great mechanical stress to their joints, their hips and their knees and ankles particularly. And I think one of the consistent successes I see in my patient in their 40s, 50s, 60s and beyond is that they report an alleviation in joint aches and pains. And this is even in people who haven't been formally diagnosed with osteoarthritis. They've never really had x-rays to determine this. They just say within a matter of weeks, I'm just feeling a lot better in my movement. My ability to do my daily functions is pain-free. And I think that's a testament again to the ability of ketones having an anti-inflammatory effect separate to just the fact that they are a great energy resource. The gut itself can improve vastly, particularly with bloating. So bloating is a big one that my patients often present with. It's often not just that, but it's one of the things that comes up in the history is that, I can look like I'm 6 months pregnant when I've had, a meal or 2 meals, and I'm not really sure what the triggers are. And funnily enough, a lot of that is actually still to do with some spectrum of gluten intolerance and or a reaction to the saccharides in our food supply, as well as the fact that there are many seed oils within our food supply as well these days that our gut is quite naive in being able to handle. So there are a number of things we would work through with patients to figure out what it is. But the fabulous thing about low carb diets is by default, they are going to be seed oil free, that's what the ideal we strive for. And they also mean that we are really greatly reducing the gluten load. And already that provides a great boost in terms of gut health. And some of the other areas that have received great emphasis and even, sort of media exposure is type 2 diabetes. And that's probably the area in Australia that has advanced the most in acceptance of using a low carb therapy to create reversal of someone's type 2 diabetes and in some cases remission, meaning that they're actually showing normal 3-month average blood sugar readings in their HbA1cs. So that alone means that we can de-prescribe medication for people who are taking oral tablets and or insulin for their type 2 diabetes. They can often come down to a much lower amount of medication required. So those are just some examples, I think, that show that there's quite a large reach. And then if we look a little further afield, things like the cancer care, and particularly in those people undergoing active treatment with standard protocols, they can always add in a dietary approach that can improve the target of their cancer therapy and or the ability to prevent relapse or recurrence of cancer. So in cancer survivorship, there is a growing body of evidence that we can actually prevent or starve out the recurrence of cancer cells. And that is phenomenal because it holds a lot of promise in a field that has otherwise been quite doom and gloom, and people feeling like there's not that much that they can control. I suppose the other two that I think are worth mentioning is in kidney disease and in heart failure. So these are two other big areas that are showing promise with the use of ketones that are made by the body. And it's not just because of the fuel source, but it's also because of all the anti-inflammatory effects of ketones. So yeah, I think it's just a vast array of areas, and we're learning every day also about how it's impacting on people just with their clarity, the way their mind functions, their energy levels, which is a huge problem because a lot of people are feeling fatigue. It's this general symptom that a lot of people report. And I think a large portion of it is related to how we eat. It's not all about that, but this is a huge component that is probably one of the ones I can describe as a controllable for people.
That is an incredible list, and it's just a great reminder. Pretty much when you think of any chronic condition, think inflammation, think what else can you do in terms of diet. And I loved how you mentioned about depression, anxiety, because I just completed Georgia Eats online training, who's a nutritional psychiatrist, all about ketogenic diets and mental health. And it's just phenomenal how inflammation drives you into more glutamate, which is more worry, anxiety, that constant rumination. And, if we take that inflammation away, we actually can make a massive difference to your mental health. And often we don't link inflammation, mental health, and great symptoms because we're thinking, oh, it's just about serotonin, but actually oxidative stress, inflammation, all play a component. So it's really nice that message is getting out there. More people are thinking, and amazing what you can do when you do a keto diet or even just low carb, to be honest, a low carb diet to start off with, to just feeling better, because often people need some kind of reward or feeling to keep going. So weight can take time, weight can take weeks, months, but it's just that feeling within days of, wow, this feels different. And like exactly what you said, better concentration. And these are the positives that keep people going. Deepa, I'd love to now move on to the Society of Metabolic Health Practitioners and what you've done for Australia to help set that up. I'd love to hear more.
Yeah, so in July 2023, together with Dr. Alex Petruszewski and Dr. Lucy Burns, we did create a society called the Australasian Metabolic Health Society. And the intention behind this society is to really elevate the profile of using nutritional therapies such as low carbohydrate approaches, ketogenic therapies as a first line option or as an adjunct to traditional therapies. This might sound like, oh, that's probably, something that might already be available, and it is, but the problem is that it is not a widely accepted way within the Australian health professional bodies of dealing with chronic diseases and optimizing health. And many societies do fall short of acknowledging the huge role of ketogenic therapies and their ability to influence so much of our disease processes because they modulate it at many different cellular levels, from the mitochondria all the way to the large tissue organs. So that is really an aspect where we are hoping to elevate that profile, provide education to health professionals, which is a first for Australia because there's no local Australian teaching or resources on this subject for health professionals. And as a result of that, we've created our first course, which is upcoming in March in Melbourne, which is about low carb foundations for doctors of all specialties, to really understand what is the breadth of improvements that can occur, even if they're simply mentioning this to their patients, supporting their patients with it. They may not necessarily need to be able to guide them completely, but even offering this as an option and knowing where to point them towards to get concrete, solid, scientific based information. So that's one of the major aims of our society, is to provide that ongoing education. And to those health professionals who become members of our society, they are able then to access ongoing monthly grand rounds where we have experts in their various fields, not just confined to medicine, but in the allied health fields as well, to present information and research that they're doing in and around the role of metabolic therapies that are really a stand apart just from the traditional use of medications. So I think the whole idea behind our society is to also look at advocacy and using a grassroots approach as well, because we acknowledge that for the wider environment to change, so our whole community to change, we need to make it easier for people to make choices around what they put into their body. And that also means not just the food that they're eating, but also the water they're drinking, the products that they are placing upon their skin, that they could be inhaling, their wider environment. And it's really talking about addressing metabolic disease with a very holistic approach. And that acknowledgement of our greater environment in the role in this is very important, and something that all our practitioners are trying to educate others on. And in our actual society, we have a scientific committee, which we're quite privileged to have, which involves 9 clinicians from around Australia who are really pooling together their wealth of knowledge to provide that to our health practitioners. So yeah, it's just we're in our infancy, but we are accelerating very fast. And there's also an upcoming great collaboration, which we've done together with Australian of the Year, Dr. James Mukey, who was Australian of the Year in 2020. Through his advocacy, we've managed to form a relationship and an invitation from Dietitians Australia to be able to provide education to their dietitian members and non-members. And I think that's going to be a wonderful opportunity as well in changing the conversation and the dialogue about Australian dietary guidelines and how they don't actually address disease in people who are unwell already, and that we can use these other therapies to achieve that. So that's another very exciting project that's happening in 2024 for the Metabolic Health Society.
That's amazing. And what we'll do, I'll add in links in the show notes as well so that they can find you.
That'd be great.
Let you go, Deepa. I would love to know, how do you balance motherhood, being a wife, being a doctor, and an entrepreneur, and doing all of this on the side, the Society of Metabolic Health? How do you do it?
I think I am not perfect at this at all, and I don't think anybody is. And with balance, it's often never really achieving that 50-50 happy spot. It's always tipping in one direction and the other, your pull between your family and your passion for your work. And more than that, what I've realized in recent years is the work that we do, particularly in our field, has both a practical aspect. Of course, it's a way of making a living and providing for our families, but it's also practicing something we enjoy and love doing. But beyond that, there's also my feeling now that I need to be able to contribute to society at a wider level and create a more positive and well-educated environment within the community particularly around food, but also around our lifestyles in general, because since having my children, I can see the type of world they're growing into. So for me, the time I spend with my work is actually also about doing something that's positive for my family as well. And the time I volunteer now with the Australasian Metabolic Health Society is all about providing that knowledge to a wider number of people within Australia who can then also take that back to their communities and families. So it does take a lot of organization, and it takes a lot of asking for help from others and not ever feeling embarrassed for the need to ask for help, and that recognizing that really to be able to achieve something, you need support, you need people who are collaborative, people who are positive, and that will always be willing to contribute, and surrounding yourself with those people to be able to do things that are great for everybody, very satisfying for everyone. And that's probably where I get my major drive from, is from that, being with a tribe or a community who believe in a cause like that. So I think, yeah, it's all a work in progress with balance. And I feel like balance is that elusive type of ideal, but also making peace with the idea that you're always going to swing in one direction or the other, and that you have to keep some tight boundaries to make sure it doesn't go way too much in one direction or the other.
Amazing, amazing advice. And I think it's something so simple, but you're absolutely right. Not many people do, which is ask for help. You can't do this on your own. Whatever you, in terms of achieving anything, you always have a team at home, at work. There's always a team approach. So amazing. Thank you so much for today, Deepa. It was so informative and such great reminders for people just how diet affects the body.
Thanks, Chami.
Remember that this is general advice only. Please see your healthcare professional for more information. So what's your take-home message today? Remember, it's all about progress and not perfection. And are you suffering from stress? Visit the Usawa Learning Hub on usawa.com.au for more resources on how to de-stress, re-energize, and reclaim your health. Enjoy the journey.